Swiftly onto a different issue on matters health. The cost of healthcare remains a key concern for most Kenyans, with the government working to implement universal healthcare to ease the burden on citizens. One of the most expensive diseases to manage is cancer, with an estimated 48,000 Kenyans diagnosed with the ailment every year. The Nairobi Securities Exchange last week held its annual charity trading day, with proceeds going towards fighting cancer. Our reporter Malika Kazia spoke to Health Cabinet Secretary Cicely Kariuki on the role of the private sector in promoting better healthcare.
Thank you so much. And of course, we're here at the NSC Charity Trading Day, and we want to speak to Health Cabinet Secretary Cicely Kariuki about what is being done in the country with regards to affordable healthcare. And of course, this fight against cancer that is constant, that is consistent, and that is the cause that this particular NSC Charity Day is supposed to be supporting. So thank you so much for speaking to us. And tell me now, what such events do to keep furthering the affordable healthcare agenda that is going on in the country, as well as the fight against cancer.
Thank you very much. This is a good afternoon, really, because in addition to what government is doing to invest or bringing in additional interventions, particularly in the universal health coverage, and specifically today, resources being mobilized through a charity event here as the National Nairobi Stock Exchange. It is important for us to reflect and say cancer is one of those conditions that has afflicted every home state, with close to 48,000 Kenyans every year being diagnosed with various types of cancers, and therefore it is important for us to also rally the private sector, what it is we have witnessed today, to be able to support or to be able to be involved in issues of delivering healthcare. Healthcare, whereas the government has a mandate to lead by way of policy, by way of standards, by way of investment, by way of ensuring their facilities. Every one of us has a civic responsibility. That is the private investors, by way of either corporate responsibility, by what we have seen today, or by way of being investors into the sector themselves. But importantly, the individuals themselves. The civic responsibility that falls upon each one of us in determining the kind of lifestyle that we move going forward, or that we adopt moving forward, has a bearing to do with the numbers that we have continued to see. So a day like this again becomes important because it's one of the days that you use to sensitize ourselves and to be able to say that there are certain types of cancers detected early. If you take up early screening and your annual medical checkups, that can be detected at early enough stage, and they can actually be managed for positive health outcomes. There are those that also, in terms of view and how you carry yourself around, your physical activity, the lifestyles that you live in terms of the drinks that you associate with, issues of smoking, that also, if you are able to manage and keep at bay, will speak and help you in terms of averting or avoiding some of what it is we are seeing today. And so it's a good day, and I am full of appreciation for the Nairobi Stock Exchange for finding it a worthy cause to partner with government in mobilizing resources, particularly to set up cancer registries where we'll be able to get data, which data then helps us in either following up cases detected, or even coming up with additional interventions to manage the cases already detected. So it's a very useful exercise here today.
Thank you. And when it comes to these registries, how is the development so far? What has already been put in place? Like you said, they're being developed. So what do we already have in place so far, and what else is going to be done in the future?
I spoke about the statistics, which currently are reference statistics, which have been gathered through the number of patients that are being seen through the facilities in the counties. But it will make more sense if we are able to collate this information and are able to then move it towards real-time access through an ICT ecosystem that then will be able to be relayed to the main specialized facilities. What that means, therefore, the issue of referring patients from lower level facility or hospitals to the more higher specialized facilities will become more seamless, will become manageable in good time, and the levels of efficiencies in decisions making will also be that much improved.
And even as we talk about the affordable healthcare agenda in the Big Four, what are some of the strides that we need to continue making even as we look at 2020 coming? And what do you think this year has been able to achieve in terms of major milestones towards that?
I want to take a reflection that in December last year, the President, His Excellency President Uhuru, launched what we considered a pilot phase of universal health coverage in 4 counties. This was Kisumu, Machakos, Nyeri, and Isiolo. And that was supposed to actually give us an opportunity for learning, for us to be able to determine the systems for health delivery, the status they were in, and what interventions will be required to deal with any gaps that we anticipated we were going to meet. It's gone very well. We have taken very useful lessons, which lessons we are using right now to be able to put together an action plan for scaling up the UHC. One of the things that has come out very strongly and is what is going to be the anchor of scaling up UHC is taking on a primary healthcare approach. What does that mean? Is that we are able to fix a lot of our health concerns by adopting part of what is viewed to be preventative, to be promotive interventions in healthcare delivery, meaning then the people that really are left with acute cases that have to lend themselves to facility attention and specialized care will be that much fewer. That is one of the biggest lessons that we pick. It is the most important one because it is the most logical way for us to invest going forward. There are a few other lessons, and we'll be sharing this as and when we are ready then to move ourselves to scale up.
Thank you so much for speaking to us.
Thank you for having us.
And there we have it. Health Cabinet Secretary Cecily Kariuki there speaking to us. Back to you in studio.
Thank you very much, Malika, for that detailed interview with Cabinet Secretary. Matters Health in this particular